Good afternoon. My name is Alexander Fagenson. I'm a surgical resident at Temple University Hospital in Philadelphia, PA. I thank the Journal of American College of Surgeons and the Southern Surgical Association for the opportunity to present and publish our work. Our paper is entitled Preoperative Substance Use, Influence on Abdominal Surgical Outcomes. We performed a retrospective analysis of the ACS NSQIP database from 2019 to 2021 for patients undergoing major abdominal surgery. We identified a little over 4,000 patients. Patients underwent a variety of abdominal procedures including ventral hernia, hysterectomy, colectomy, which was a majority of our patient population, with a small subset undergoing cholecystectomy, appendectomy, nephrectomy, and hiatal hernia repair. We found in our patient population that 11% of patients were on preoperative opioids, while as 10% were on preoperative benzos, and these patients were on substances for 180 days prior to their operation. We also found a small subset of patients, 2.3%, that were on both substances prior to the operation. What we found is that those patients on preoperative opioids and benzos had significantly increased serious morbidity, length of stay, and readmissions with respect to their naive counterpart. In addition, this effect on morbidity was compounded when patients were on both substances. Finally, we performed a multivariable regression analysis for serious morbidity. We found that those patients on opioids and benzos had a significant risk of a serious morbidity with an odds ratio of 2.65, whereas those patients just on opioids or benzos alone also had an increased risk, albeit was a little lower, with an odds ratio of 1.7 for opioids and 1.61 for benzodiazepines. So furthermore, in conclusion for our paper, preoperative opioid and benzo use are independent risk factors that contribute to postoperative morbidity, and the influence on surgical outcomes is exacerbated when patients are on both substances, and providers should be aware of those patients on preoperative substances when counseling for surgery. Thank you for the opportunity to present.